For many years, one of the biggest challenges facing Burkina Faso's healthcare system was not simply the shortage of hospitals or medical professionals. The real challenge was what happened during the critical minutes before a patient ever reached the hospital. When a road accident occurred, when a pregnant woman experienced life-threatening complications, or when someone suddenly suffered a stroke, families often had to find transportation on their own, while every passing minute reduced the patient's chance of survival. Today, that reality is gradually beginning to change. In just 1 year of official operation, Burkina Faso's Emergency Medical Assistance, a service better known as SAMU, has handled more than 15,000 emergency interventions and processed hundreds of thousands of calls for assistance. What began as a new emergency response service is now evolving into one of the country's most important healthcare coordination systems, connecting patients, ambulances, medical specialists, and hospitals through a centralized emergency network. But this story is about far more than impressive statistics. It raises a much larger question. Can a country strengthen its healthcare system not only by building more hospitals, but by ensuring that medical care reaches patients when every second matters? In Burkina Faso, that question has become increasingly important as the government expands emergency medical services while pursuing broader healthcare reforms. In today's video, we will explore why SAMU was created, how its emergency coordination system operates, what more than 15,000 interventions reveal about the country's healthcare needs, the challenges that still remain, and how plans to expand this network across Burkina Faso could reshape emergency medical care for millions of people. We will also examine the role of government policy under Ibrahim Traore, consider different international perspectives surrounding these reforms, and discuss why many observers believe this experience may offer valuable lessons for other African countries seeking to improve access to emergency healthcare. If you enjoy balanced, in-depth analysis of Africa's major developments, please subscribe to the channel and join us as we continue exploring the stories shaping the continent's future. For decades, emergency medical care in Burkina Faso faced a challenge that extended far beyond the walls of hospitals. The country's healthcare professionals were capable of saving lives, but reaching patients quickly enough often proved to be the greatest obstacle. In many emergencies, families were left to search for private transportation, negotiate crowded roads, and decide on their own which hospital might provide the necessary treatment. Those precious minutes between the onset of a medical emergency and the arrival at a healthcare facility frequently determine whether a patient survived or suffered permanent complication. This situation highlighted a critical weakness in the healthcare system. Building hospitals alone could not solve the problem if patients were unable to reach them safely and rapidly. Medical experts around the world often describe the first hour following a severe injury, stroke, heart attack, or complicated childbirth as the golden hour. During this period, timely intervention can dramatically improve survival rates and reduce long-term disability. Before the creation of SAMU, Burkina Faso lacked a nationwide emergency medical coordination system capable of responding during these decisive moments. Traditional ambulance services existed in some areas, but they were generally limited to transportation. Communication between hospitals was often fragmented, and patients were sometimes transferred without real-time coordination regarding available specialists or medical equipment. In many cases, ambulances functioned primarily as vehicles rather than mobile medical units equipped to begin treatment before arriving at the hospital. Recognizing these limitations, the government introduced the Emergency Medical Assistance Service, known as SAMU, as part of a broader effort to strengthen the country's healthcare system. The objective was not simply to purchase additional ambulances. Instead, policymakers sought to establish an integrated emergency response network capable of connecting emergency calls, medical regulation centers, trained healthcare professionals, ambulance teams, and hospitals into a single coordinated system. Under this model, every emergency begins with a centralized medical regulation center instead of patients or their families deciding where to seek treatment. Trained professionals assess each situation, determine the level of urgency, dispatch appropriately equipped medical teams, and direct patients toward healthcare facilities capable of providing the necessary care. This approach reduces delays, improves coordination between hospitals, and increases the likelihood that patients receive appropriate treatment during the most critical moments of their illness or injury. The creation of SAMU therefore represented more than the launch of a new emergency service. It marked the beginning of a structural transformation in how emergency medicine is organized across Burkina Faso. Rather than viewing ambulances simply as transportation, the system redefines them as extensions of the hospital itself, bringing trained medical personnel, life-saving equipment, and immediate care directly to patients. This shift laid the foundation for the significant expansion that would follow during the system's first year of operation. One of the defining features of Burkina Faso's emergency medical system is that every request for assistance follows a carefully coordinated process rather than relying on chance or individual decisions. Behind every ambulance dispatched to an emergency lies a network of trained professionals whose responsibility is to determine the most appropriate response within minutes. This centralized model is one of the reasons SAMU has become far more than a traditional ambulance service. It functions as the operational brain of the country's emergency healthcare network. Everything begins when someone dials the national emergency number 15. Whether the call comes from the scene of a traffic accident, a family caring for a critically ill relative, or a healthcare facility requesting assistance, it is first received by the medical regulation center. Unlike a standard emergency call center that simply records information and dispatches the nearest vehicle, the medical regulation center evaluates each situation from a medical perspective before making any operational decision. Specially trained personnel gather essential information including the patient's location, symptoms, age, medical condition, and the circumstances surrounding the emergency. Physicians responsible for medical regulation then assess the urgency of the situation. Their role is not only to determine whether an ambulance should be dispatched, but also to decide what level of medical support will be required during transport and which healthcare facility is best equipped to continue treatment. SAMU organizes its activities through two main categories of intervention. The first is primary intervention, which involves responding directly to patients at their homes, workplaces, public spaces, or accident scenes. In these situations, medical teams provide immediate assessment, stabilize the patient's condition, begin life-saving treatment when necessary, and safely transport the patient to an appropriate hospital. This rapid response is particularly important during strokes, heart attacks, severe trauma, respiratory emergencies, and obstetric complications, where every minute can significantly influence survival and recovery. The second category is secondary intervention. Although less visible to the public, this represents a substantial portion of SAMU's daily workload. Many patients are initially admitted to local hospitals that may lack advanced diagnostic equipment or specialized medical services. SAMU coordinates their transfer to larger healthcare centers capable of performing complex imaging studies, specialized surgical procedures, intensive care treatment, or other advanced medical interventions. By organizing these transfers through a centralized system, patients are directed to facilities that match their clinical needs while reducing unnecessary delays and improving coordination between hospitals. Each ambulance serves as a fully equipped mobile treatment unit rather than a simple transport vehicle. Medical teams typically include a physician, a nurse, and a specially trained ambulance driver. Before every mission, essential equipment is carefully checked, including oxygen supplies, cardiac monitoring devices, intravenous medications, emergency drugs, resuscitation equipment, and patient monitoring systems. During transport, the medical team continuously observes vital signs, administers treatment when necessary, and communicates with the receiving hospital to ensure that preparations are already underway. Before the patient arrives, this integrated approach transforms the ambulance into an extension of the hospital itself. Treatment no longer begins only after reaching the emergency department. Instead, life-saving medical care starts from the moment trained professionals arrive at the patient's side, significantly increasing the chances of successful treatment during the most critical stages of a medical emergency. During its first full year of operation, Burkina Faso's emergency medical assistance service demonstrated that the country's investment in coordinated emergency care was responding to a genuine national need. The numbers alone provide a remarkable picture. More than 216,000 emergency calls were processed through the Medical Regulation Center, while over 15,500 medical interventions were carried out across the system. These figures are significant, not simply because they are large, but because they reveal how quickly the population began relying on a service that had only recently become operational. At first glance, many people might assume that most emergency interventions involved road accidents or patients requiring immediate rescue at the scene of an emergency. However, the operational data tells a more complex story. Approximately 4,100 interventions were classified as primary responses, meaning medical teams travel directly to accident scenes, homes, or public places to provide emergency treatment before transporting patients to hospitals. More than 11,000 interventions, however, involved secondary transfers between healthcare facilities. This means that nearly 3 out of every 4 missions focused on safely transferring patients from one medical institution to another, where more specialized treatment or advanced diagnostic equipment was available. These numbers reveal an important reality about Burkina Faso's healthcare system. SAMU is not only responding to emergencies outside hospitals, it is also strengthening communication and coordination between hospitals themselves. Smaller healthcare facilities frequently encounter patients whose conditions require specialized surgery, advanced imaging, intensive care, or highly trained medical specialists unavailable at the initial location. Rather than leaving families to organize complicated transfers independently, SAMU has become the bridge connecting different levels of the healthcare system. Another revealing statistic concerns the total number of incoming calls. While more than 216,000 calls were received during the year, only a fraction resulted in ambulance deployment. According to official reports, a significant proportion of incoming calls did not involve genuine medical emergencies. Some callers requested information, while others contacted the service for situations that did not require emergency intervention. Although this creates additional pressure on medical regulators, it also demonstrates that the public increasingly recognizes the emergency number and views SAMU as an accessible point of contact during moments of uncertainty. The rapid increase in demand reflects growing public confidence. Emergency medical systems depend heavily on trust. People must believe that calling for help will result in a rapid professional response. As successful interventions become known through families, communities, and local healthcare providers, confidence naturally expands. Each patient safely transported, each emergency successfully managed, and each family assisted during a critical moment contributes to strengthening the credibility of the entire system. Perhaps the most significant conclusion from these statistics is that they measure far more than operational activity. They illustrate the emergence of a nationwide emergency coordination culture. Every completed intervention represents communication between dispatchers, physicians, ambulance crews, nurses, drivers, and hospital staff working together toward a common objective. In this sense, the 15,000 interventions recorded during SAMU's first year are not simply medical missions. They represent thousands of coordinated responses that are gradually reshaping how emergency healthcare is delivered throughout Burkina Faso. One of the main reasons behind SAMU's rapid acceptance across Burkina Faso is its commitment to reducing financial barriers during medical emergencies. In many developing countries, families often hesitate before calling for professional help because they worry about transportation costs or emergency service fees. During a stroke, a serious road accident, or a life-threatening pregnancy complication, even a short delay can significantly reduce a patient's chances of survival. Burkina Faso's emergency medical policy seeks to remove that obstacle by ensuring that life-saving assistance is available when it is needed most. Under the current system, emergency interventions involving immediate threats to life are provided without charge. The objective is simple but important. When a medical crisis occurs, families should focus on saving the patient's life instead of worrying about how to pay for emergency transportation. By removing this financial burden, the government encourages citizens to contact SAMU immediately rather than delaying treatment while searching for other options. The policy also provides additional protection for vulnerable groups. Pregnant women and children under 5 years of age who already benefit from national healthcare support programs can receive certain medical transfers without additional cost. This approach helps ensure that those facing the highest medical risks receive timely access to specialized hospitals when advanced treatment is required. Beyond its medical value, the policy also strengthens public confidence in the healthcare system. Families with limited financial resources gain greater assurance that emergency care is available regardless of their immediate ability to pay. This contributes to more equal access to life-saving services and encourages greater trust in public healthcare. At the same time, Burkina Faso has adopted a balanced financing model. Not every transport provided by SAMU is entirely free. Some non-emergency secondary transfers may require a socially subsidized fee, allowing resources to remain focused on the most urgent cases while supporting the long-term sustainability of the service. Ultimately, this policy reflects a broader vision of healthcare. Emergency medical assistance is treated not only as a clinical service, but also as an essential public responsibility. By reducing financial barriers during the most critical moments, SAMU is helping more citizens receive rapid medical care when every minute can make the difference between life and death. Although SAMU has achieved important progress during its first year of operation, its growing success has also exposed several major challenges. As more people become aware of the service, the demand for emergency medical assistance continues to increase. Expanding the system while maintaining fast response times has become one of the most important priorities for Burkina Faso's healthcare authorities. One of the biggest challenges is the enormous number of incoming calls. During its first year, the Medical Regulation Center processed more than 216,000 calls. However, only a small percentage required ambulance deployment. Many calls involved requests for information or situations that did not qualify as medical emergencies. While every call must be evaluated carefully, handling unnecessary requests places additional pressure on dispatchers and may delay responses to patients facing genuine life-threatening conditions. Another challenge lies in the high demand for inter-hospital transfers. Official statistics show that secondary medical transfers significantly outnumber primary emergency responses. This reflects an important reality within the healthcare system. Many regional hospitals provide essential medical care, but must transfer patients to larger facilities for advanced imaging, specialized surgery, intensive care, or other complex treatments. As a result, SAMU is responsible not only for emergency rescue, but also for connecting different levels of the national healthcare network. Expanding the service presents another complex task. Building a Nationwide emergency medical system requires much more than purchasing additional ambulances. Every new vehicle must be supported by trained physicians, nurses, ambulance drivers, communication specialists, medical equipment, maintenance services, and reliable coordination centers. Without these elements working together, increasing the number of ambulances alone would not guarantee faster or better emergency care. Geography also creates significant challenges. Burkina Faso has large rural areas where long travel distances and limited road infrastructure can increase response times. Reaching remote communities quickly remains one of the most difficult operational objectives for any emergency medical service. Despite these obstacles, health authorities continue strengthening the system by expanding human resources, improving operational capacity, and extending emergency coverage beyond the country's largest cities. The experience of the first year demonstrates that while significant progress has already been achieved, building an effective nationwide emergency medical network remains a long-term process, requiring continuous investment, careful planning, and sustained public support. The first year of SAMU's operation has demonstrated that emergency medical coordination can significantly strengthen Burkina Faso's healthcare system. The next challenge is to transform these early achievements into a nationwide network capable of providing rapid medical assistance to citizens regardless of where they live. Rather than viewing SAMU as a service limited to the country's largest cities, health authorities are working toward a long-term vision of expanding emergency medical coverage across Burkina Faso. The expansion strategy follows a gradual approach. After establishing the National Coordination Center in Ouagadougou, authorities introduced a regional branch in Bobo Dioulasso to extend emergency services across western Burkina Faso. This decentralized model reduces pressure on the capital while bringing emergency medical coordination closer to surrounding regions. Future expansion aims to strengthen coverage throughout the country's remaining administrative regions, creating a more balanced national emergency response system. Achieving this objective requires much more than increasing the number of ambulances. Every new regional center must be supported by trained physicians, nurses, ambulance drivers, dispatch personnel, communication systems, medical equipment, and hospitals capable of receiving critically ill patients. A successful emergency network depends on every part of the system functioning together. An ambulance alone cannot save lives if there is no properly equipped hospital prepared to continue treatment upon arrival. The government is therefore combining the expansion of SAMU with broader healthcare investments. New health facilities are being developed, additional medical personnel are receiving specialized training, and emergency care capacity continues to improve across multiple levels of the healthcare system. These parallel investments are intended to ensure that emergency transport and hospital treatment evolve together rather than separately. If these plans continue successfully, Burkina Faso could establish one of the country's most comprehensive emergency medical coordination systems. Citizens living outside major urban centers would gain faster access to professional emergency care. Hospitals could cooperate more efficiently through coordinated patient transfers, and critical medical resources could be distributed more effectively across the national healthcare network. Ultimately, the future of SAMU will not be measured solely by the number of ambulances on the road or the number of emergency calls received. Its long-term success will depend on whether every citizen, regardless of location, can receive timely medical assistance during the moments when rapid intervention makes the greatest difference. That objective represents the next chapter in Burkina Faso's ongoing efforts, strengthening its national healthcare system. The development of SAMU is closely connected to the broader healthcare reforms taking place under the leadership of Captain Ibrahim Traore, while the daily operation of the emergency medical service is managed by healthcare professionals and the Ministry of Health. The expansion of emergency medical care reflects a wider government strategy aimed at strengthening public services and improving access to healthcare across Burkina Faso. Rather than focusing on a single project, the government has promoted multiple initiatives designed to reinforce the national healthcare system. Alongside the expansion of SAMU, authorities have invested in mobile hospitals, improved healthcare facilities, increased medical training, and strengthened emergency response capacity in different parts of the country. This effort suggests that emergency medical Services are being viewed as one component of a larger strategy to modernize healthcare delivery. Within this framework, Ibrahim Traore's role is primarily political rather than operational. His administration has emphasized the importance of increasing national capacity to provide essential public services, including healthcare, particularly in regions where access has traditionally been more limited. The objective is not simply to improve hospital infrastructure, but also to ensure that emergency medical assistance can reach patients quickly, regardless of their location. At the same time, Burkina Faso's broader political environment has attracted criticism from several Western governments, international organizations, and human rights groups on issues such as governance, press freedom, and civil liberties. These concerns have generated ongoing international debate. However, it is important to distinguish these political discussions from the performance of the country's emergency medical system. To date, there has been no significant international criticism directed specifically at the creation or operation of SAMU itself. A balanced assessment therefore requires separating healthcare outcomes from broader political disagreements. The effectiveness of an emergency medical service should be evaluated through measurable indicators such as response capability, patient access, coordination between hospitals, and the number of lives assisted. By those operational measures, SAMU's first year demonstrates meaningful progress while also revealing areas that still require continued investment and improvement. The distinction allows observers to recognize healthcare achievements without overlooking the wider political debates that continue to surround Burkina Faso. The experience of Burkina Faso's first year with SAMU offers lessons that extend beyond the country's borders. Across many parts of Africa, governments face similar challenges: growing populations, limited medical resources, long travel distances, and unequal access to specialized healthcare. While each country has its own circumstances, the development of an organized emergency medical coordination system demonstrates that improving emergency care is not simply about acquiring more ambulances. It requires building an integrated network that connects emergency calls, trained medical personnel, transportation, and hospitals into a single coordinated service. One important lesson is that emergency medical systems should be developed as part of broader healthcare reform rather than as isolated projects. Burkina Faso's experience shows that emergency transport becomes far more effective when hospitals, healthcare workers, communication centers, and medical equipment are strengthened at the same time. Coordination is just as important as infrastructure. Another lesson concerns public trust. An emergency service can only succeed if citizens know when to use it and believe that help will arrive quickly. Public education therefore becomes an essential part of building an effective emergency response system. Reducing unnecessary emergency calls while encouraging people to seek help during genuine medical crises remains an ongoing priority. Burkina Faso's experience also illustrates the importance of evaluating healthcare reforms through measurable outcomes. Political debates surrounding governments often receive international attention, yet the performance of public health programs should also be assessed through practical indicators such as emergency response capability, patient access, medical coordination, and improvements in healthcare delivery. Examining these results separately allows a more balanced understanding of both achievements and remaining challenges. Whether SAMU ultimately becomes a nationwide model will depend on continued investment, careful planning, and the ability to expand services into remote communities. Nevertheless, its first year has already demonstrated that coordinated emergency medicine can play an increasingly important role in strengthening national healthcare systems. For many observers across West Africa, including countries such as Mali and Niger, Burkina Faso's experience provides an example of how healthcare coordination can gradually evolve despite limited resources. While every nation must develop solutions suited to its own circumstances, the broader lesson remains clear. Building an effective emergency medical system begins not with vehicles alone, but with organization, trained professionals, and a long-term commitment to ensuring that life-saving care reaches every citizen when it matters most. The story of SAMU's first year is ultimately about much more than emergency vehicles, medical equipment, or operational statistics. It is about how a country attempts to strengthen one of the most critical parts of its healthcare system by ensuring that professional medical assistance reaches patients during the moments when every minute matters. More than 15,000 interventions completed within a single year represent not only thousands of emergency responses, but also thousands of coordinated efforts involving physicians, nurses, dispatchers, ambulance teams, and hospitals working together toward a common objective. The experience also demonstrates that effective emergency medicine depends on organization as much as infrastructure. Ambulances alone cannot save lives without trained medical personnel, reliable communication, functioning hospitals, and coordinated decision-making. Burkina Faso's approach illustrates how these different elements can gradually be integrated into a unified emergency response system capable of serving an increasing number of citizens. At the same time, important challenges remain: expanding services into remote communities, increasing the number of trained professionals, improving public awareness, and maintaining sufficient financial and operational resources will determine whether SAMU can fully achieve its long-term national objectives. Building a nationwide emergency medical network is not a project completed within a single year, but an ongoing process requiring sustained commitment and continuous improvement. The broader significance of this experience extends beyond Burkina Faso itself. Across West Africa and the wider Sahel region, many countries have continued searching for practical ways to strengthen public healthcare systems despite limited resources. As governments explore different approaches to emergency medical coordination, Burkina Faso's experience may contribute valuable lessons to regional discussions involving Africa, NEWS, the African Union, and neighboring countries such as Mali and Niger. Together with leaders including Ibrahim Traore, Assimi Goita, and Abdurrahmane Chiani, these developments are increasingly shaping conversations about healthcare resilience, national capacity, and regional cooperation. At the same time, international partners, including France and other external stakeholders, continue to observe how these reforms evolve and what they may mean for the future of emergency healthcare across West Africa. The future of SAMU will ultimately be measured not by the number of vehicles on the road, but by the number of lives protected through faster access to professional medical care. If this progress continues, Burkina Faso's emergency medical system may become one of the country's most important long-term public health achievements. If you found this analysis valuable, please subscribe to the channel, share your thoughts in the comments, and join us for more in-depth discussions on the major developments shaping Africa today. We sincerely appreciate your time and support. Every video on this channel is carefully researched, thoughtfully written, and meticulously edited by our dedicated team. We don't rely on automated production or shortcuts to create our content. Every story, every visual, and every detail is crafted with genuine care, passion, and a commitment to bringing you meaningful, high-quality videos.